Now back to one of our other top stories today, the hospital situation in Gauteng. The Premier, David Makhura, has revealed that there are over 4,000 COVID-19 admissions in the academic hospital, Steve Biko. And he visited the hospital this morning following pictures that were circulating on social media. And these pictures were showing the hospital turning a parking lot into a COVID-19 ward. Now, for reaction on the situation at Steve Biko Academic Hospital, as well as other hospitals in the province, I'm joined now by Mr. Simphiwe Gada, the Gauteng Democratic Nursing Organization of South Africa's chair. A very good afternoon to you, sir. A rather troubling situation and turn of events that we're seeing specifically at the Steve Biko Academic Hospital. Talk to us about the situation there. What exactly is going on?
Well, thank you, and afternoon to the viewers. The situation at Steve Biko Academic Hospital should not come as a shock, firstly, to the Premier, because if you recall that when the Premier discharged the former MEC of Health from his duties and also the HOD and other senior officials, as a DENOSA, we reacted to say that what he's doing is creating a crisis because he's bringing instability to the Department of Health in Gauteng. So it shouldn't come as a shock because this is a direct consequence of the decisions that he has taken in the past by paralyzing the Department of Health. So I think he should take responsibility for that, because when we were winning the war against COVID and the numbers were going down, that was the opportune moment for his government to better prepare, because it cannot be a surprise that we are now in a second wave. In fact, the second wave was predicted already. So we knew that going into the festive season, we would be having these challenges. So it can't that now when he reacts because of what he has seen on social media, and all of us must clap hands for him. That was just a PR exercise as far as we're concerned. We think that the Premier should take responsibility together with his cabinet, because the situation in all Gauteng hospitals was created by his lack of foresight, in the sense that when we spoke out against the paralyzing of such a crucial department, we're seen as if we've got something, a personal vendetta against him. And we want to say that there's no way that such a crucial department cannot have, senior managers who are able to take long-term decisions, because what we have seen there was a plethora of people acting in this position. So really, we cannot be surprised, because right now the situation is doing exactly what is happening is exactly what we predicted. Health workers are overstretched, they are fatigued. If we had planned better, health workers would have gotten the opportunity to go and rest. So you can imagine people who have been working under strain since the first wave of COVID-19, and right now we cannot expect them to perform miracles. They are human beings, they are overstretched, they are tired. And what puts salt on the wound is the fact that today, as we speak, we have got other leaders of DENOSA who are doing a sit-in at the provincial command center in Newzroom, where they are protesting against the release of post-community service nurses, because our view is clear. You cannot, when you are sitting with a crisis, you still say that you cannot afford to absorb nurses that you have employed yourself as government, whereas you are sitting with a dire shortage, because we've got over 78 nurses who, in fact, over 78 nurses who have passed away in Gauteng, and those posts were not filled, they were not replaced. Some have resigned and some have retired, so they have not filled those posts. So with all these challenges that we have, we cannot afford to then have nurses that will be loitering the streets unemployed. So the Premier, really, him going there is not going to assist the people who are in the triage, because what we have seen over the weekend, the tents there, it's not that they are treating COVID patients. That is a triage area where the initial assessment happens before it is then decided that you've tested COVID positive, you must then be transferred into a COVID ward. So really, from where we're sitting as DENOSA, we can't be clapping hands for the Premier for going there. In fact, that is just a PR exercise as far as we're concerned.
Now, Mr. Gada, the reports coming from the Steve Biko Academic Hospital is that all the wards are filled to the capacity with COVID-19 patients. Yes, now we are seeing, as the pictures are demonstrating, that the parking area has been converted. In one of the pictures there was actually even water on the ground and people were standing in the water and the hospital beds were in water. How prevalent is the situation in other hospitals in Gauteng, apart from the Steve Biko Academic Hospital?
Well, the first point that we must make is that we recall that Steve Biko Academic Hospital, as well as Tshwane District Hospital, which it's a complex of hospitals, we recall that those are the hospitals in the province that assist us in dealing with this pandemic, together with Charlotte Maxeke Hospital. Now, other hospitals then assist. But in terms of for instance, Tshwane District Hospital has been turned into a COVID-only hospital. So it is expected that you'll have such a huge number, you'll have such high numbers of people looking for help. And also you recall that with the migrant labor system, where many people are returning from rural areas for economic opportunities in this province, you've got those who are coming from Zimbabwe and so forth. You are expected to sit with such a problem, because the infrastructure that we have was not designed to deal with the high demand of health as we are seeing today. It was not designed to deal with the high number of of the population demanding to have medical attention or health access to healthcare services. So what you are seeing there, if you go, for instance, to other hospitals, it also depends on where the hospital is located. Because I know that if you go to Helen Joseph, you will not find such a situation. If you go to Jameson Hospital, we had a similar situation, but it was handled. But we expect that in the hospitals which have been designated to deal with COVID would have such, because you recall that if an ambulance takes a person to hospital, they would take them in these hospitals. For instance, you'll find this in Charlotte Maxeke, the tents are there. You go to Tembisa, the tents are there. You go to, I've already mentioned Bethakwa in Jamestown, Telemokweran and so forth. So throughout the province, these tents were put there as part of a response mechanism to say that patients, because today everybody is suspected to have COVID unless otherwise proven, different from that. So these tents are put there as a safety measure for other patients who are coming to the hospitals with other diseases, because in these tents, what happens is that the PUIs, the patient under investigations, are treated in these tents. They are tested in these tents. Once a person has been confirmed to be COVID positive, they are then moved from these tents into a COVID ward. You'd know that if a person is COVID positive, they will require other forms of medical attention. For instance, they would require oxygen. Now, in these tents, you don't have the kind of oxygen that you would administer to a person who's suffering from, who is in dire need of oxygen because of COVID. You also cannot treat such patients who need ventilators and so forth. So these tents, it's a matter that we must communicate that these tents are triage tents. They are not for confirmed COVID cases. The people who are treated in these tents are people who are still presenting with the symptoms, who are still under investigation, and once confirmed, they are then moved to those COVID wards. But we must also say that the COVID wards themselves are overstretched, they are full. So this tells you that when the wave of COVID went down, what was supposed to happen is that we're supposed to prepare better for the second wave, meaning that the field hospitals which were identified were supposed to have been capacitated. Now, all those monies were redirected into other needs, and our position was clear that we cannot relax because we see the numbers dropping. Whereas we're heading into the festive season, and in the festive season, that's when people tend to relax when it comes to their social conduct and so forth, because the spike in these COVID cases is also directly linked with the manner in which people have been conducting themselves. And we have always called on South Africans to take self-responsibility when it comes to this issue of COVID, because We even said that people must practice what we call PPB, personal protective behavior, because at the end of the day, the solution or the responsibility lies with each and every citizen. You must take self-responsibility, but we cannot excuse government for the lack of preparedness, because the first wave was supposed to give government more experience and more knowledge on how to better prepare moving into the future.
Mr. Gada, we'll leave it at that for this afternoon. Thank you so much for that update, troubling and disturbing as it might be. The overcrowding at the Steve Biko Academic Hospital in the city of Tshwane, and also the fact that there has been a shortage of ventilators and a shortage of nurses and staffs, also a problem at this time.